My name is Dr. Gia Kelly, and I'm so grateful again to be able to offer this presentation today on racism and its impact on children's social and emotional development at NTTAC. Early childhood is one of the areas that we focus on as we talk about system of care, as we talk about how to support young people in their mental health. And we know that it starts in early childhood. So this is our efforts to really talk about how can we support children very early in their development, but also to understand the impact that racism has on that development. And so again, we are so happy you are taking time out of your schedules to join us today. Before we get started, we have just a few housekeeping things that we need to go over with you. Again, thank you all for sharing your names and location in the chat box. And so there's a disclaimer on the screen, and as a part of our session, we must provide this disclaimer. This presentation was prepared by NTTAC under a cooperative agreement with SAMHSA. While the event is supported by SAMHSA, we just also want to let you all know that the contents are those of the authors and do not necessarily represent the official views of SAMHSA, HHS, or the U.S. government. Also, we want you all to know that we have some great partners within NTTAC. We cannot do this work without partnership. That partnership is central to the work of our center. And so on the screen, you can see our phenomenal partners. We have the Center for Applied Research Solutions, or CARS, which actually leads the center. They're our prime. We also have the University of Texas at Austin. We have the family-run Executive Director Leadership Association, which is our family engagement partner. We have Change Matrix, which is the amazing organization that I am employed by. We have Youth Move National. We have Georgetown, the Center for Child and Human Development. We also have the AAP and Georgetown University Hospital. So that makes up our wonderful team of partners. As a center, our vision at NTTAC is that all children, youth, and families that are living with and impacted by mental health challenges will have access to the resources and opportunities that they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, including everyone from state leaders to providers to school workforce, infant and early childhood providers, community-based providers, peer supervisors, family partners, youth partners, and much more. Our services range from individual consultation to more in-depth sessions like the one you're attending today. And there's also peer learning exchanges and tools that can help you. Our aim is to really create those outlets for communication, collaboration, and resource sharing amongst all of us. We want to make sure that you would go to our website when you get a chance and really look at the full array of resources that we offer to the field free of charge. So please take advantage of the resources that we have and our upcoming events. We're almost there. And then just for some commonly asked questions, most folks want to know if they're going to get a certificate of completion. And yes, a certificate will automatically be emailed to all online participants in the follow-up email. And if you join by phone by phone only, we want to ask that you would please email Joanne Bloom at the email that you see on the screen to report your participation. Also, some folks want to know, can you get a copy of the presentation that was used? And a copy of the presentation will be sent out within 2 days of this session. And then also the recording of this session will also be sent out as we are recording this session. And it will be posted also on our website. So those are just some commonly asked questions that we like to answer in advance. And we are moving forward with our presentation, and I want to take a minute to introduce to you our team for today. So I've already introduced myself, and I'm the Director of Transformation Teams at NTTAC and also the co-lead for our cross systems partnership team, and I am serving as your moderator today. That is my role as a moderator. But I have some amazing guests today who will be taking the leadership on the content for today. And the first is Dr. Chantel Meek. Dr. Chantel is the executive director of the Children's Equity Project, also known as CEP. She's also a professor of practice at Arizona State University. The Children's Equity Project is a multi-university initiative that aims to close opportunity gaps between children from historically marginalized communities and their peers. Our next presenter is Dr. Darielle Blevins. Dr. Blevins is a mother of a beautiful daughter and an auntie to a brilliant niece. Dr. Blevins serves as an assistant research professor at the Children's Equity Project at Arizona State University. In her role, she acts as a technical assistant advisor with the Center of Excellence on Infant and Early Childhood Mental Health at Georgetown University. So we see how all these things kind of intersect, right? As Georgetown is one of our partners, where she supports state leaders, practitioners, and programs to embed equity into mental health consultation. And then last but not least, we have Dr. Evandra Catherine, who is the Director of Disability and Mental Health Policy at the Children's Equity Project. Dr. Catherine works with state and national leaders to build and sustain equitable early intervention and early childhood special education systems for children birth to 5 and their families. And I'll put the link in the chat where if you want to read more, and get their full bios, I will provide that information to you. So without further ado, I'm going to hand things over to our wonderful team to be able to share with us their presentation. One moment. And so Dr. Meeks, over to you.
Thank you, Dr. Kelly. It's wonderful to be with you all today. My name is Chantel Meek, and I lead the Children's Equity Project at Arizona State University. Just to build on what Dr. Kelly already mentioned, the CEP is a policy center at Arizona State University focused on building more equitable child serving systems across an array of different systems, including mental health, but also early care and education, K-12, child welfare, immigration, and so on. We work across research, policy, and practice, and across all of the levels from local to federal and national issues. So for our conversation today, I'm going to start just with a little bit of framing here. In May of last year, the National Academies of Science, Engineering, and Medicine published a new report on closing the opportunity gap for kids birth to 8. Within that report, right, I was on that committee for that report. We looked at a whole array of different issues that impact access to opportunity, experiences within systems, and then disparities in outcomes for kids across the birth to 8 spectrum. And just to frame our conversation today, this report had a number of different conclusions that were paired with a whole set of policy recommendations. But really, one of the main conclusions here was, not surprisingly, right, that children of color, children with disabilities, children living in poverty, and others have been harmed by structural factors that have created and perpetuated gaps in opportunity in young children and in their families that include systematic exclusion, structural racism, unequal allocation of resources and services, labor market inequity, biases within services and in access to services, and really policies that create administrative burden for families. I think we know that systemic racism really is an umbrella or maybe the root to a lot of these other pieces that we see here. So we're going to talk and dig into that in just a bit. So before we jump into that, we're going to do a little bit of framing that was developed by the Racial Equity Institute out of North Carolina. It's a wonderful training organization that provides racial equity training to folks, and they developed what's called the groundwater approach. Um, and what this is kind of a metaphor for systemic racism and structural racism that they've developed, and I think really helps frame, just get us in the right frame of thought for when we start digging into to mental health systems in the next part of the presentation. So if you can all just imagine you are walking outside in a big, beautiful grassy field. And it's a beautiful day, the sun is shining, you're admiring what a nice day it is, and you come across a lake, right? And you look at the lake and you are admiring how nice it looks and the sunshine reflecting off the water. And you look down and you notice that there is a fish belly up in the water. Well, I would ask you, right, what would be the first thing that would come to your head, right? Most people would begin to come up with hypotheses about what happened to this fish, right? And start to make guesses as to what might have happened, right? Did the fish get caught in a fishing hook? Did the fish eat something it shouldn't have? Was the fish sick for some other reason? You'd start to, think about what happened to this individual fish. And then as you walk around the lake and continue your walk, you notice another fish and another fish and another fish. And by the time you make it all the way around the lake, you kind of assess roughly that about half of the fish in the lake are belly up. Well, at that point, and at some point along the way, you would stop making those individual hypotheses, right, about the fish. What happened to this one and this one and this one? They're not independent questions or individual questions anymore. We would start to make hypotheses about the water. What is it in this lake's water that is making so many of the fish sick? Well, now imagine you pass this lake and you keep walking and you come across a second lake. And you walk around that second lake and you notice the same pattern, right? With half of the fish belly up. You walk to a third lake and you notice the same pattern, and a fourth and a fifth and a sixth. At that point, you would probably stop wondering what's wrong with this lake, and what's wrong with this lake, and what's wrong with that lake, and what's wrong with this lake. Again, this is not a question, right, of individual lakes. This is a question of what is wrong with the groundwater that is feeding all of these lakes, that is impacting so many fish and making so many of the fish sick in the lake. And so when we think about this in the context of racial equity, right, all of the systems, right, that we have are the individual lakes, right? We have the education lake and the health lake and the criminal justice lake and, the early childhood lake, and they're all their own systems and their own lakes, right? But they are all fed by the same groundwater and ideologies that impact what's happening to the fish in those particular lakes. So the Racial Equity Institute then kind of shares a chart that kind of further takes this lake metaphor and really applies it to various systems. So if you look at the black boxes at the bottom, those are the lakes, right? We have health, we have education, criminal legal, child welfare, finance. If you look at the tiny black print above those boxes, they are just example outcomes from each of those systems. And then what's actually charted in those line graphs, you'll note, is the likelihood of having a bad outcome compared to white people in the United States. So African American is the red line, white people is that black line. And the first thing that folks might notice from this chart, right, is that it's very zigzaggy. So there are some outcomes where the difference is smaller, and there are some outcomes where the difference is giant, right? A large difference. But the other thing that I would point out, right, is that the lines never cross, right? There is a consistent pattern in the lines, right? Where the black line is below and the red line, whether it's close to the black dot or not, it is always above, right? And so what is feeding the groundwater in each of these systems that is systematically disadvantaging, withholding opportunity, harming, and so on and so forth, Black people in the United States and in these systems. So the second piece I'll mention is a research study that was conducted several years ago that is another sort of metaphor to help us understand racism over the course of time in the United States, right? So most people in the United States have played Monopoly or know about Monopoly or generally know what's happening. I was just gonna pause. I see some back and forth in the chat about my slides. Can everybody see them? Can you see them okay, Dr. Kelly?
Yes, we're good. I think it's just one person that may have some individual
Oh,
issues.
okay. Okay, sorry about that. So folks generally know Monopoly. These researchers brought a bunch of folks in and they set up a bunch of tables in a room with a Monopoly game at each table. And there was a handful of people in each group, in each table, right? And for each table, they named a group 1, a group 2, and a group 3, right? So there's a couple of people who are in group 1, a couple of people in group 2, a couple of people in group 3 at each table. And they said, all right, everybody knows how to play Monopoly. These are the rules of Monopoly. Everybody's going to play by the same rules. We have equal rules implementation in this game of Monopoly. But the difference is we're going to have staggered entry into the game. So group 1 is going to start and play 7 rounds. And then after they play 7 rounds, group 2 will come in. And then group 1 and group 2 will play 5 more rounds. Mommy, and then after these...
A new message.
Okay. And then after these 2, group 3 will enter. And then we'll continue playing. And so basically we have the same rules and different and a staggered entry. So what the researchers found was that the winner is reliably and always from group 1. I'm sorry, just one second. Sorry about that. My son really wanted my attention to show me a message that he sent me under the door. So I just have to show that off. All right, so the winner was always from group 1. We also know that the order of winners always followed the sequence of game entry. It wasn't that anyone had any special talents or skills at playing Monopoly. It was just literally following the sequence of entry into the game, right? We also knew that groups 2 and 3 rarely built the same level of assets as group 1. And then a particular interesting just observation from the researchers is that discouraged by their inability to make meaningful progress, researchers noted that late starters often wish to land in jail to avoid landing on expensive real estate. So when we think about this concept, right, I think it's important to keep this timeline in mind, right? When we're thinking about racial equity, when we're thinking about staggered entry, when we're thinking about all these different pieces, right? I don't know, I'm not an economist. My husband does our taxes. I don't know much, but I do know that wealth compounds over time and that money compounds over time. And that when you start with more, you're able to make more and you're able to save more and you're able to have more, right? I also know as an education researcher that one of the biggest predictors of a child's educational outcomes is their mom's educational outcome. And so a lot of the pieces and the outcomes that we looked at earlier, right, compound over time, carry across generations. And so when we think about the timeline, right, of the United States, 88% of the timeline was the period of American slavery and legal segregation, or the Jim Crow era. We're not in the green now, right? But if we think about those pieces, that's 88% of the timeline. So shifting now or zooming in now from that framing, keeping those pieces in mind, keeping history in mind, keeping where we are in the grand timeline, right? How do we think about child equity, right? We know that children need consistent, warm, responsive caregivers to thrive. We know that they need access to healthcare and safe and stable housing and nutritious food and safe communities and quality educational experiences. We also know that throughout US American history, that set of conditions has not been a reality or afforded to many children as a matter of policy, as a matter of practice, as a matter of how we spend or allocate resources. So an understanding of equity requires us to understand and pay explicit attention to history and to systems, to understand the origins of this country and systems and policies, and their evolution and manifestations today, and how they are continuing to promote inequity in our systems. So a few months ago, me and my esteemed colleagues, two of which you'll hear from in just a bit, published a book called Equity for Children in the United States, where we provide some more framing. So I'm just going to read this. Equity for children requires policies, investments, and supports that ensures that all children have access to the resources, relationships, and conditions they need to thrive. It requires providing resources to repair past harms to communities that have been historically marginalized, and passing policies that address inequities in both access to systems, services, resources, experiences, and experiences within those systems, with the key goal of closing opportunity gaps and disparities in outcomes across social demographic groups. So within this book and in our framing of equity for children and racism and its impact on children and families, we kind of break down three major systems. And of course, we're going to zoom into mental health after this initial framing, but really three key systems that really shape children's ecosystems, that really shape children's environments and the conditions under which they are growing up, right? So I'm going to go just briefly over some of these before we transition to mental health, right? The first one is economics. From the period of enslavement and colonization of land first inhabited by American Indians, we know that resources in this country have been extracted and distributed according to established social racial hierarchies that were developed to maintain and perpetuate power. So slavery was an economic system carefully designed to hoard and concentrate resources, property, wealth, power, right, to folks who are wealthy and white and generally men. We know that state and federal laws, many decades after, continued that same goal, right, of concentrating resources, power, wealth that resulted in exploiting Black people and other people of color in the United States. And there are lots of examples of laws that were quite explicit in this purpose, right? We know the GI Bill didn't afford the same opportunities to Black soldiers as it did for others. We know the Social Security Act had definite holes. We know laws like the National Labor Relations Act, right, provided, by and large, provided employment and labor protections for people, but excluded categories of workers that were disproportionately Black, right, agricultural and domestic in that period of time. We also know that Jim Crow laws, right, were another evolution of the same type of dynamic, right, the same pattern, excluding Black folks from voting, from education, from health system, from economic systems, again, with the purpose of hoarding power, advantage, resources, wealth, and so on. And so from our perspective, we can't talk about racism without talking about economics, and we can't talk about poverty or wealth without talking about racism, because from the very beginning of this country, they have been inextricably linked. And what does that mean, right? What does that look like? We have as poverty as an example, right? This chart is from the National Academies of Science, Engineering, and Medicine poverty report that was published a few years back, right? That shows that Hispanic children and Black children are disproportionately represented in various levels of poverty. And when we link that to child outcomes, right, it doesn't take a stretch of the imagination. There's lots of research that shows that children who are growing up in poverty are more likely to have material hardship, food and housing insecurity, poor education opportunities, maltreatment, physical health impairments, mental health challenges, and so on and so forth. So within economics, beyond poverty, we think of these three pieces: economic stability, right, which is your ability to meet your basic needs. Can you buy food? Can you reliably pay for your shelter and housing? Can you afford healthcare? These basic needs that individuals have. We know that over the course of history, and there's plenty of data that shows that Black US Americans are overrepresented in lower wage jobs, so are Latinos. And as a result, of some of the laws that I mentioned earlier, right? But employment discrimination, minimal labor protections. We know that Latinos are disproportionately represented in low wage jobs, a lot of which is domestic labor and agricultural. We know that immigrants without documentation suffer from the largest rates of exploitation, higher than others. And we also know that when you think about the intersection of race and gender, there are massive pay gaps with respect to that, with women of color across all groups earning less for the same work as their peers, with Latinas earning the least compared to their female peers across every other category. The second piece is economic mobility. So your ability to change in income over time, increase in income over time, whether over the course of an individual's life or across generations, right? We know that people of color have less upward economic mobility and higher downward economic mobility than their peers. We know that there's been a lot of research done by Chetty and colleagues and many other folks that have looked at this issue of economic mobility. They found that a white child born to parents at the top income levels is about 5 times as likely to stay there in adulthood compared to a Black child from similarly wealthy family who is as likely to fall to the bottom group as they are to remain in the top group. Of children who were born in the bottom fifth of the income distribution, over 10% of white children, but only 2.5% of Black children make it to the top fifth of adults. So of course, this isn't the economic mobility we want for everybody, for anybody, but it is especially pervasive and difficult for Black families and other families of color. The third piece is wealth generation, right? The value of assets minus debt, which over time can provide those different pieces that we talked about: economic security, economic mobility, opportunities for the future, and so on. We know that there is a large racial wealth gap between Black and white families that is stark, it's intergenerational. We know that the net worth is significantly different between these two groups of families because wealth accumulates and appreciates over time. The racial wealth gap is perhaps the clearest manifestation, right, of history's influence on contemporary disparities across all of these different groups. We already talked about those intersections between racism and economic systems in this country. Some additional statistics from the Brookings Institute, right? White single parents have approximately 2 times the wealth of 2-parent Black and Latino households, right? So often we hear these disparities explained away as individual decisions, right? Oh, it's the marriage rates are low, and oh, it's single family house, right? Well, when we compare white single parents to 2-parent households, Black and Latinos, right? We still have this gap there. We also know that white college graduates have more than 7 times the wealth of Black college graduates. Again, often we hear the narrative, right, and the ideologies, oh, it's just bad decisions, right? It's just you don't have the right priorities for education. Well, even when you control for that, right, and we look at folks who graduated from college, we have that. So the second big domain beyond, after, and associated with economics is the education system, right? Everything from early care and education, from infant, toddler, child care and preschool settings on through K-12 education and higher education. And here, you know, I won't spend too much time talking about this. I know one of my colleagues is gonna dig in a little bit more in this space. But when we think about inequities and opportunity gaps in the education system, I think one, I'd refer you to the National Academy's Opportunity Gap Report, which details everything from facilities to per pupil expenditure to discipline to instruction and so on. But just reflecting, right? When you look inside of a school or a childcare program, whose language is the default, right? Whose history is the default? Whose books are the defaults? What race is the teacher most likely to be, right? And why is that? Who is still segregated in 2024, right? As a matter of allowable policy, right? If you think about kids with disabilities, you think about English learners. As a matter of policy, if you think as a matter of practice, then we look at racial segregation as well. Who is still excluded? If we think about discipline, which we're going to dig into a bit in subsequent slides, think about who is secluded, right? We have seclusion rates that are atrocious, really, that show that kids with disabilities make up like 12%, I think, of the K-12 population, but 60 or 70 some percent of kids who are secluded and restrained. And secluded means, just to back up, it means locking a child in a room by themselves without the ability to get out. So when we think about children's experiences in the education system, these are just some of the pieces and examples that help us understand like the different factors that are shaping what those experiences look like and outcomes. So it's just one clear example and manifestation, right, of that systemic racism playing out in preschool settings, which a lot of people don't automatically think, oh, we see racism in preschool, but here we are, right? We look at these data is federal data from the Civil Rights Data Collection. I think these are a few years old, but the new data don't show major differences. If we think about boys, right? Black boys make up about 20% of the male preschool population, but 45% of male preschool suspensions. We see similar patterns with even larger disparities for Black girls, right? Where they make up 20% of the girls in preschool, but 54% of the girls suspended. And then the last piece is health, right? And again, we're gonna hone in on mental health in the next piece, but in thinking about, right, health, it's not just physical health or mental health, it's all of the surrounding conditions and how racism impacts all of the surrounding conditions that make up the ecosystem where kids are born, where they are growing up, where they play, where they eat, where they learn, right? If we think about environmental racism, right? And the impacts of decisions of where to build highways and where to build toxic waste sites and where to, we know that those decisions were made very intentionally, right? And that Black people and other people of color have greater exposure to some of these toxins, right? In the air, in the water, and so on. We know that housing segregation and de-investment or lack of investment in communities, right, results with less access to resources at the community level, including food deserts, food insecurity. We know that healthcare access is a major challenge, and we also know that the quality of healthcare and bias that's within the healthcare system also contributes significantly to disparities in health outcomes. We know that places to play and green space and parks and all of these things, there are disparities and inequities in the environments in which kids are growing up that impact mental health, that impacts other types of outcomes as we move. So as we turn to mental health systems, I think there's just a few things to finish off this very long framing at the beginning of this presentation, right? We have to consider history. We have to consider where we've been and how we got here. We have to consider context, right? And sometimes that requires zooming out and not zooming in to think about the very specific, but all of the different factors that are influencing the conditions that impact children's mental health and so forth. And then finally, we have to consider in making reforms to our current systems, right? These three pieces that we talk a lot about at the Children's Equity Project. Access, who has access to services, to supports, to resources? For who is it easy? For who is it hard to receive access? What are children and families' experiences once they have access to a particular resource or service or support? And how do they differ across groups? And then what are the outcomes that we see? And where are the disparities across groups that we could then plug to help us understand what we're doing wrong in the services and service delivery and supports and systems and the access piece. So with that, I'm going to pass it to my colleague, Dr. Blevins.
Thank you. I am going to be talking about some of the research that tells us what factors influence mental health and child development particularly. I come to this having had experience in most of my early jobs or early roles coming out of grad school was as a behavior specialist, right? Or an inclusion coach. My master's is in multicultural counseling. So as I moved into the research space, it was always interesting to me to think about outside of what we do in direct service, what are things that impact and factors that really influence children's health and their mental health and their well-being. And so we know, as Chantel has, or Dr. Meek has outlined for us, racism is a huge factor when we're talking about children's social emotional development and their ability to thrive, right? So Kamara Jones, who is the former president of the American Public Health Association, she describes racism as the system of structuring opportunity and assigning value based on social interpretation of how one looks, right? That unfairly disadvantages some individuals and communities and advantages others, right? The American Academy of Pediatrics, they describe racism as a socially transmitted disease passed down through generations, right? So Dr. Jones, in one of her articles, asks or suggests that we start to ask, how is racism operating? And then we're also going to ask, and then what is the impact? Right? And so several studies have come out that is saying racism operates like a stressor. And we know when the brain is stressed, it's hard for children to focus, right? And it actually damages the structure of the brain. And so we'll review some of that research today. So we'll use this model that was created by Dr. Yoma Aruka and her team of researchers for us to think about specifically what is the impact of these different forms of racism on children and their development, right? Starting with the broader blue section of cultural racism. Right, cultural racism can sometimes be described as the water we swim in, right, or the air that we breathe. Some things that may seem invisible or have become invisibilized because they're quote unquote our norm now. And so when we're thinking about mental health or the mental health field, we think about some things that we take for granted or are just accepted, right? For instance, our acceptance of using the medical model, right? Some would describe the medical model as using a set of codes to diagnose or even to assess a problem, right? And so these set of codes are the quote unquote norm. And if someone isn't aligning with that norm, then we think that the problem lies within that individual, right? And then we start a treatment plan, right? Or a behavior plan based on those individual factors. The medical model doesn't always account for societal deficits, right? Or these forms of racism that Chantel has outlined and that we're going to outline further, right? So thinking about the ways that it shows up, that these forms of racism show up in mental health field, in the social emotional support field, and so how that impacts the child once it gets to the individual level. And so within the little green circle, you can see that sometimes that racism or those biased beliefs become internalized, right? Which we know also has an impact on identity. So I'll begin with sharing some factors that influence child development, like social determinants of health, right? Social determinants of health are conditions in the environment where children are born, where they live, where they play, where they learn, where they grow up and develop that impact our health. So the CDC outlines these 5 domains and has recently come out with more literature saying that these other forms of social, the way we're structured socially, like racism, patriarchy, capitalism, ableism, are also social determinants of health and mental health, right? They impact the ways that children's opportunities are structured, they impact the interactions that children have, and they impact the well-being of children. And so as we think about racism, we have to think about how the inequities exist across these domains and also how they exist, how inequities act as a social determinant of health within itself. One major thing for us to think about, because there has been several studies looking at the impact of adverse childhood experiences on children's well-being, right, and on their development. Unfortunately, 9.4% of children who are 0 to 5 have experienced 2 or more ACEs, right? Adverse childhood experiences. And the research shows us that the more exposures to ACEs that a child has, the more likely they are to have negative outcomes, whether that be in health or mental health. Thinking about ACEs in this visual is useful for us to think about what are some of the roots, right, that contribute to that and that contribute to inequities and exposure to ACEs, right? And so some studies have shown that over 50% of Black youth report experiencing moderate to severe symptoms of depression, right? And 20% report exposure to racial trauma. So as we're thinking about adverse childhood experiences, it's important for us to consider the impact of racial trauma and what that might look like. We've all been through and are still coping with this global pandemic, but also the racial uprisings that happened during that pandemic, and thinking about what children have been exposed to, whether it was in their own neighborhood or community or what they saw on TV, right, as a traumatizing experience. We also know that there are other factors that were related to COVID that really exacerbated the stress of children and their families. A recent report showed that the proportion of mental health related emergency room visits for children ages 5 to 11 rose by 24%. Right. So we're living in a time where children are experiencing a lot of stress, and that stress is inequitably distributed by race, by children who have other forms of discrimination that may be impacting their life and their development. We know that another factor that influences mental health and child development is just children's access to quality treatment, right? So we found that Black and Native children are less likely than their white peers who already have diagnosed mental health disorders to receive treatment, right? And so thinking about and unpacking some of the reasons for that is mistrust, and I say mistrust due to mistreatment, right? So there are some communities of color who have a history of being mistreated by the mental health field, by the medical field. And so there's almost a healthy mistrust because of the ways that we haven't had enough protections in these spaces. Right. And so we often say that medical providers or mental health providers, anyone interacting with communities who have experienced mistreatment, need to work to earn trust, right? To reduce that barrier. We also know that proximity to mental health services can be a huge factor when considering the ways that Black and particularly Native American children and families can access treatment. And there's a shortage. There's a shortage of qualified, right, culturally responsive providers who have less of a barrier of creating that therapeutic alliance or just building relationships because of a shared lived experience. Another major factor is inadequate data, right? When we don't have the data that we need, it's hard for us to identify a problem and address inequities, right? And so Latino children have been completely understudied in this area. The research that we do have does suggest that there's a cause for our concern, in that 22% of Latino youth also have expressed depressive symptoms, right? Which is a rate that's higher than most other groups. And we don't have enough information to understand what are the contributing factors to this and how we can remedy some of those. We know that another factor that influences mental health is food insecurity, right? Food insecurity in several studies, longitudinal studies, cross-sectional studies have confirmed that as food insecurity increases, so do some psychological distress and other mental health outcomes, specifically depression, right? So children growing up in families that are food insecure usually tend to have higher levels of symptoms of anxiety or depression, right? Their reaction is often aggressive, right? Or can be hyperactive. And one issue with that is that there is disparities in who experiences food insecurity, right? We can see this chart showing us that there's great disparities by race, as Black and Latino children are more than 2 times as likely to be food insecure, right? So we have to think, what does that mean for their mental health and their well-being? There is increasing research on the impact, and I see some of the wording is cut off, on the impact of parents, right? And parents' well-being, both their health and their mental well-being, on children, specifically on birthing parents and their experiences on a developing fetus, right? So some research is telling us that systemic racism, so a parent's experience with discrimination, can even impact the uterine lining, right, as a fetus is developing and growing, right? There is a term coined by Arlene Geronimus, right, that says that Black women, particularly what her research was on, actually their body experiences strain and advanced aging because of their constant experience with sexism and racism, right? And that impact contributes to the way that their child has received stress in the body, and also contributes to a barrier in developing attachment with the child even when they're born, right? So the impact of stress and anxiety really related to experiences of microaggression or poor housing and housing discrimination is already having an impact on the child who is developing, and especially also in their early years. There's also more research coming up about the brain, right? And the impact of stress on the brain. We've known for a while now that stress has a negative impact on the brain. And so now there's a push to understand, what are the racial impacts of that, right? What impacts does structural racism have, when we know that childhood trauma can have a lasting effect, right? So researchers, the researcher pictured here, his name is Nathaniel, right? And they wanted to better understand how we identify the development of stress and trauma-related conditions, especially given that Black Americans are disproportionately exposed to childhood adversity, right? So what does that mean for how we're looking at conditions? So they examine MRIs, thousands of MRIs and brain scans of children ages 9 and 10, and they notice differences by race, right? So upon digging deeper and using other data like self-reports of adversity related measures, they used some census data. They found that it wasn't necessarily race in general, but it was the experience and the exposure to adverse experiences that started to change the structure of the brain, even in adolescence. They saw differences in how these children developed conditions like PTSD, right? And they had a direct correlation to the amount and in the exposure of childhood traumas. And that was directly related to the amount of matter in the brain. And so they did more research, and he's been writing more pieces about the need for more research on how structural racism, right, is a cause for some of these differences that we see in, as he calls it, psychiatric disorders. There's more research on the epigenetics, inheritance of trauma, right? And so some of that research has been done with mice. There's a researcher named Bianca Jones Marlin who was looking at the ways that mice, when they've had a stressful event, can transmit that through their genes for several generations, right? And so they show they stress a mouse, and they also show them or let them smell this almond smell. And they found that even a mouse who had not been stressed, but can smell the almond starts to have some of the same reactions as their parents, even if the offspring had not experienced the trauma, right? So they're wondering, what does that mean for people, right? When a grandparent or a parent experience extreme trauma and their brain changes, and some of those brain changes have been passed on to their offspring. Some of Bianca Jones Marlin's research is actually, what can we do to support that? So they took it a step further and they put some of those mice in a room or in a little box with another mouse who had not been traumatized, and they found that there were mitigating effects, right? So most of us are familiar with attachment theory, right? So there is some good news that when these mice were then comforted and consoled, and there's a cute video where she says when they're given little mice kisses, right, that it actually does improve some of their experiences and some of their feelings of that trauma, even though she notes it doesn't change the structure of their brain still, right? And so we want to think about, what does that mean for the work that we're doing? What does that mean for how we view challenging behaviors? When we have children coming to us who may have experienced trauma themselves, or they may have inherited, right, the impact of that trauma from a parent who experienced severe trauma, especially related to racial trauma, right? Sometimes we focus on what we see, what we hear, right? Which might look like, if you're a behavior specialist like me, a child throwing a chair, right? Or a child throwing what we call a tantrum or showing aggressive behavior. But what does that mean for how we talk about these behaviors and how we think about our approach to treating it? Right? Often our approach is individual, or our support is individual, right? We don't always think about the historical ways that trauma can be impacting this child and their actual current behavior. And so we wanted to offer this time just to briefly stop and reflect on some of the research that we talked about before we move forward, even though we're going to keep going, so we know we have enough time for everything. But just personally, think about, what are the implications of some of these studies in your role, right? What does this mean for your model and how you're doing your work? I'm going to keep going so I can have enough time to pass it on to my colleagues. And so I'm going to bring us back to our model. We're going to shift from thinking about some of these cultural forms of racism or structural forms of racism and thinking about, what does this mean interpersonally, right? How they show up. And sometimes interpersonal racism shows up more as a bias we've developed and a bias that impacts how we interact. And so we've seen, and researchers have found, that one form of bias is adultification bias. That specifically means that adults may perceive Black children as 4.5 years older than they actually are, right? They perceive them as more aggressive just because of stereotypes that they've heard and learned. Specifically for Black girls, there was an overwhelming amount of adults who reported perceiving Black girls as less innocent, right, and in need of less nurturing. And so as we think about adultification bias and the ways that our views and our lens might be inaccurate, you have to think about, what does that mean for developing relationships? We know that bias can impact discipline, right? And bias in how we perceive behavior influences discipline decisions and contributes to discipline disparities. We found that Black girls are actually 6 times more likely to experience exclusionary discipline, right? Either suspensions or expulsions, than their white peers. And Black boys are 3 times as likely. There have been a number of studies done specifically by Walter Gilliam in uncovering how bias might manifest even in young children and preschool age children, right? And so he did a study in which he asked educators to watch videos and particularly look for which child was misbehaving. right? And so it was just children sitting at a table playing with Play-Doh, I think, or just playing with little manipulatives. And adults identified who they thought were misbehaving. I actually believe that they tracked their eyes, right? So who the adults paid the most attention to. And you can see this chart shows us that the adults paid the most attention to Black boys, right? And then white boys. And what the caveat is, there was no misbehavior happening. There was nothing happening because all the children were child actors, right? But this really uncovered the ways that bias can influence what we see. He did another study in which educators were given contextual information like a child's background, a child's family situation, and then asked to rate the severity of their behavior. And it showed us that sometimes educators understanding a child's background doesn't actually garner empathy in the way we thought it would, because they actually rated their behavior as more severe when they found out that a child had a more complicated background. And so we understand through these studies the ways that bias may impact our view and may also impact the ways that we view children's families. There was a popular, or actually a landmark doll study case done back in the 1930s, in which these researchers, who were actually married, the Clarks, they're the Clarks, but they wanted to understand, like, what is the impact of segregation on Black children specifically, right? Like, how do Black children see themselves? And so their study asked children a series of questions about 4 dolls, and I believe these are the actual dolls. They're in a museum right now. They're identical except for color. So they would ask them questions like, which doll do you think is the most beautiful? Which doll is most like you? Which doll do you prefer? And they found that these Black children attributed mostly positive terms to white dolls, and they used negative terms for Black dolls. They found that 62% of these children preferred the white doll. And what they concluded was that prejudice, discrimination, and segregation created a feeling of inferiority among African American children and damaged their self-esteem. There's several interviews, and I suggest you look them up, of these researchers sharing their accounts of even conducting the studies. And he said that there were some disturbing, even just reactions to the questions, right? Some children felt it too stressful to even compare a Black doll and a white doll and would run out of the room, right? And so this study gives us a glimpse into what does it look like for a child to have internalized messages of inferiority for so long that they are complicated in even addressing the issue. Even though this study was conducted in the 30s and really popularized in the 40s, it's been replicated at this point hundreds of times, and the results seem to be constant. We still live in a time in which structural racism and these forms of oppression and segregation are internalized in particularly Black children, but they've also now done studies with other groups, in that they're still less likely to prefer their own ethnicity and themselves. I'm going to go faster. What about the experiences of LGBTQ youth and children, right? We know that these children live in a world, in a society in which heterosexism still exists. And because of that, they experience more bullying, right? And they experience bullying at higher rates than their straight and cisgender peers. And we must think about the experiences of dual language learners. What does it mean to not have access to education, right? Or to mental health care in your home language, right? And what does this mean for us as we transition into thinking about policies? I'm going to pass it on, but what does this mean for our theory of change, right? What does this mean for our workforce, for our evaluation process? We can think about these questions in relation to all of the data and all of the research that we've showed when we're thinking about the experiences of children who have experienced the structural forms of racism and oppression broadly. And so I'm going to pass it on to my colleague Evandra to talk about mental health systems, policies, and programs.
Thank you so much, Dr. Blevins. I appreciate it. I'm going to jump into mental health systems, policies, and programs. I know all of you all's minds are turning right now. There's been a lot of comments and questions and interactions in the chat. So thank you so much for following along and keeping us going. So first thing I'm going to do is sort of talk about our mental health system broadly. Dr. Meek and Dr. Blevins has really given us an idea and understanding of racism and its impacts, the system and its impacts, the groundwater that's really funneling up some of these inequities. We know that in this country, our behavioral health system is primarily made up of Medicaid. It's the single largest payer for mental health services in the United States. For children currently, Medicaid is covering about 40 million children under the age of 18 in the United States. And then we know, as you have all learned, that children exposed to a host of things are impacted. Their mental health is impacted. And also keeping in mind the racism that's built within the Medicaid system, as well as administrative burdens that's built into this system for families that, even though they may be covered within this system, they still don't have equitable access and experiences and outcomes as their peers do. What we know about the mental health system is there in 2021, about 1 in 4 children were diagnosed with a mental health issue. So we have about 26% of our children who are being diagnosed. That's diagnosed. But think about all of the children, all of the families that we've been talking about, all of the identities that do not have that equitable access to even receive that diagnosis. So that number is probably much larger, and particularly for individuals of color. Diagnosis of children mental health conditions in ages 5 to 17 rose almost 22% in a 4-year period between 2017 and 2021. This is really bringing to like this issue, right? The number of children that we have that are faced. And again, these are aggregate numbers. These numbers are not, these numbers do not sort of show what this could look like in different groups. But we do know, as you've heard, that Black, Latino, and Indigenous families and others are disproportionately impacted. Their mental health is for sure. We also know that for this, families are spending a lot of their money. Families are spent an estimated $31 billion in 2021 on child mental health services. $31 billion. That makes up nearly half of all child medical spending. And if you see here in this slide, when we think about who pays for health services, as I mentioned before, Medicaid is the single payer. You have your commercial insurance at about 34%, and then parents are paying about 8% out-of-pocket expenses for healthcare. So when we think about mental health, and we're talking about social and emotional development of children, and we know that 1 in 6 children aged 2 to 8 years old have a mental, behavior, or a developmental disorder. I'm not sure what happened to my slide here, but what I'm depicting on this slide is that the definition of infant mental health, and it's really infant and early childhood mental health, so those children birth to 8, it's really that young child's capacity to experience, regulate, and express their emotions, which is emotional development, and then form close and secure relationships, which is their social development. And we want this to all happen in the context of their family, their community, and in their environment, right? But we also know that the definition of social and emotional development is also the same. In fact, Head Start says that early childhood mental health is the same as social and emotional development. That's really, really important, because for social and emotional development, if it's really mental health and truly mental health, which we know that it is, the interventions, the treatment, the prevention, the promotion would be more targeted towards a child's mental health, as opposed to just simply viewing it as social and emotional development. Oftentimes, the emotional piece is not a large piece of the social and emotional development. It's often forgotten about. Teachers often doesn't have the training for the emotional piece. And then again, that emotional piece is attached to one's mental health. I'll share just an example for me. I have a child, Black boy, who entered the early childhood space on an IEP. And when we transitioned from preschool to kindergarten, he was suspended for a meltdown. And as a mother who had had this child for 5 years, all I wanted for the school to do was to give him some emotional supports. At this time, which was 10 years ago, I didn't have the knowledge that I have now. But what the school told me was that they couldn't give me emotional supports because 1, it wasn't measurable, and 2, it wasn't an IDEA service. So My child wasn't able to get any support for his meltdowns, but we were offered social stories, which is not going to help with the meltdowns. So I am really, really passionate about the field, truly understanding and reconceptualizing infant and early childhood mental health, particularly as social emotional development, so that we can make sure that our children and families are getting what they need, and we are not being told that we can't get something because it's not a recognized service. So when we think about these children who need services to support their mental health, right? Nearly 8 in 10 children with depression receive treatment. So we're thinking about who's getting treatment, right? We see only 60% of children with anxiety are receiving treatment. And then we also see that 53% of children with behavioral disorders receive treatment. Again, bringing in racism, bringing in access, bringing in experiences and outcomes. We know that these numbers are likely very much larger for children of color and other identities that are impacted by racism. This chart here just simply shows what those conditions look like over time and across the age span. When we see, of course, as our children get older, there are more children that have depression and anxiety. But when you look at the behavior disorders, you can see in that age between 6 and 11 years old, it's much higher in the area of behavior disorders, right? I'm going to get into some of the diagnostic tools that we use to identify and diagnose some of these things later. But what we know is that many, if not all, of these conditions in the early childhood years are really just neurodevelopmental disorders. These are things that are going on with their brain structuring, their wiring as they're developing, and how they're learning skills, right? So next I'm going to talk about like when someone mentioned this in the chat a second ago, but thinking about the overlap of everything that was described in this lane, and particularly this one is looking at ADHD. Some of you may have seen this visual before, but what you'll notice is that the symptoms of trauma and the symptoms of ADHD could look very much the same. And right in the middle, they overlap, right? And many children of color have experienced trauma. And as Dr. Blevins has explained, their families have, their mothers have, and some of that trauma may be transitioned down through epigenetics. So some of our kids might be receiving a diagnosis of ADHD, which is in fact, they may have experienced trauma. That prevention, that promotion, and that treatment and those interventions would look different for a child who've experienced trauma as they would for a child with ADHD. Again, bringing us back to sort of reconceptualizing how we see social and emotional learning. We need to view it as the child's infant mental health, particularly in those younger years, birth to 8, so that these children can get the right supports that they need. And then we also know families of children that have these conditions or symptoms also need those supports as well. So making it comprehensive and making it holistic for the family and the child, because as a mother of a child of a son with Asperger's or on the spectrum, those meltdowns were very intense for me. And I had to hold space for his meltdowns and had to comfort him and give him the nurture that he needed as he had to experience the world around him. My son probably also had manifestations of trauma because as his mother, I was homeless for most of my childhood and I've experienced a significant amount of trauma. I also was a first responder to the attacks on 9/11 in the Pentagon. So I'm a disabled vet with PTSD. All that happened before my son was born. So again, my son has probably received some of my responses to trauma, which are manifested in by ways of his Asperger's and his disability. So what does this look like? What are we doing as a nation, right? What are some of those policies that are really helping us to recognize the impacts of what was shared earlier, the impacts of social determinants of health, the impacts of maternal health, particularly maternal depression, as well as being preventative and thinking about our children, right, and screening them. There was a study done where it looked at states' Medicaid policies. Again, Medicaid is the single largest payer. And what are some things that Medicaid is doing to support and policies to support screening for some of these things so that we can mitigate those effects, right? Such as Dr. Blevins mentioned with the mice, so that someone can give that child that additional hug, that additional comfort, that additional support. And again, all in the context of their environment and their family and community. So what does that support looks like in those contexts as well, even when those children are outside of their early care and learning settings, as well as outside of their school-based setting. So we know that some states do reimburse for screenings for social determinants of health. In your role, it could be very helpful to know whether or not your state Medicaid system reimburses for that, so that you can ensure these children and families are getting properly screened for social determinants of health and getting access to the resources that they need. The same with maternal depression screening. Some states do reimburse for maternal depression screening, and maternal depression is one of the single things that has the greatest influence on a child's mental health, right? Similar to attachment, right? If a child's parent is depressed, that child's parent may not be able to hold in mind and hold space for that child to experience, as well as to be there, to be nurturing and being responsive to that child and sensitive to that child's need. So screening for maternal depression, again, whether or not your state does it or not all states do, would be helpful to know in your work. And then also, many of you are probably familiar with the early and periodic screening, diagnostic, and treatment system through Medicaid, which ensures that children during their they are sometimes wild, but during their well child visits, making sure that they're being screened early and getting referred to the resources and supports they need. We know that early intervention and supports are key to our children and families, and we want to prevent later and long-term negative outcomes. And so early detection, early screening is really, really, truly going to be important as you're in your work and you're thinking about the impacts of racism, structural racism, internal racism, that interpersonal violence between people, as well as microaggressions, ACEs, et cetera, right? There are so many things that are impacting certain groups of people in this country, and we really need to, as a field and collaboratively, really have an understanding of what we could do in that process. And again, referring families and children for these particular screenings, especially if Medicaid reimburses for those screenings. Next, I wanted to talk about, if my slide goes, programs that are actually going to support these children. I know many of you are here, you're in programmatic roles, many of you are practitioners, clinicians providing direct service. Just broadly, we all know that the US has drastically changed racially and ethnically. We know that our birth to 5 population is way more diverse than we've ever been. 54% of children under 6 were children of color, right? While people of color comprise just 42% of the US population. Again, 26% of children under 6 are Hispanic. And this group comprises about 19% of the overall population. Some of these numbers might be a little bit different. This was as of 2022. And then again, you can see that 12.7% of young children were Black and non-Hispanic, where they represent 11.9% of the population. So just in general, these are the children that you're working with in your early care and learning settings, your publicly funded pre-K settings, your publicly funded childcare settings, and then also in your school-based settings. So within our early care and learning programs, we know that they are serving children across the ages 0 to 5, and even prenatally, we're serving mothers as well that are pregnant mothers. And we know that they're being served in home-based settings, center-based setting, Head Start, private, public, pre-K settings. These programs have different standards, they have different models, they have different quality, and we know our children are being served across a range of settings, as well as across a range of quality programs as well. We know that data indicates that only 4% of Black children, and only 1% of Black children and 4% of Latino children, I might have got that backwards on my slide, are in high quality state funded pre-K. Head Start has built-in mental health supports, including infant and early childhood mental health consultation, but it's never been fully funded. It only serves about 40% of preschoolers and 10% of infants and toddlers. So again, many of our children are in relative care as well, that kith and kin. And then another part of our early care and learning programs is that many states do operate an infant and early childhood mental health consultation system that serve children across, again, a variety of settings, including childcare, home-based, home visiting, pediatrician's office, early interventionists. But we know many kids right now across the, well, not many, because we're not really reaching as many as we can, but we know there is a number of children that do have access to infant and early childhood mental health consultation, which I'll go to in a little bit. I'm checking the time here. Infant and early child mental health consultation, it is a preventive intervention in which a mental health professional is partnered up with a professional that's working on behalf of children and their families. It can happen at the program level, it can happen at the teacher level or the individual provider level, or again at the child level that this service is being provided. I mentioned that it is provided in a number of childcare programs across our state, and it has really, really amazing outcomes for kids of color. We know that the research right now shows that while anti-Black racism is pervasive in early childhood education settings, particularly in the curriculum and teaching practices, that infant and early childhood mental health consultations show these really strong effects with our culturally diverse children, especially Black children, but boys. So we know from the research that infant and early childhood mental health consultation, it improves teacher-child interactions, right? And this is seen more with Black children. It decreases challenging behavior and also increases teacher self-efficacy, and there's less burnout with infant and early childhood mental health consultation. And when the mental health professional is racially or ethnically matched with the teachers, these improvements are even greater. And one point that I want to mention in this space as we think about racism, there's a thing that's called racial ethnic socialization. And someone in the chat earlier had mentioned that Black teachers show bias towards children and may be viewed as harsher towards children, or teacher of colors may be viewed as harsh when there's a match. But what we do know through racial ethnic socialization, because of all of the things that were mentioned, because of adultification, because of fear of the police, many Black families and other ethnic families have to teach their children to suppress their emotional states. And if you're supposed to have experience a full range of your emotions, whether those are positive emotions, challenging emotions, negative emotions, that's how you build and develop your infant mental health. But some children and families have not had that luxury to experience them. It's not gonna be good or healthy to be Black and say I'm angry or I'm mad, because that would trigger some people to be fearful of Blackness. And so in infant and early childhood mental health consultation, teachers, consultants, providers, when you're working with individuals of color and you might view what they're doing as harsh, you might want to reconceptualize that and rethink that and see that as a preparation for bias. Folks of color have to prepare their family members, their children, for bias, particularly boys, so they don't interact with police. So as we're doing emotional development and we're thinking about the mental health of young children, think about those young children who in their community and home settings may not get the opportunity to express and experience a full range of emotions. So their early current and early learning environment may be that only space. And not only does the children, but also their teachers need support, because as a Black mother, I'm going to prepare my son for bias. I'm going to tell him there are certain situations where you cannot experience or express your emotions in the way that you would do at home and in the community. That is impactful on its own to your mental health, to not be able to be a full person, right? So I just really want you to think about how your programs are set up, how your pediatrician's offices are set up, how your workspace is set up when those children come in there and they may not be experiencing emotions in the way in which you feel they should be, right? When you're suppressing your emotional state, that causes you to be dysregulated. So if you see a Black child, a child of color who may be dysregulated, this reflects back on the fact that that child has been suppressing their emotional states, and this might be the one time that they just got an opportunity, and it's confusing for them. It's dysregulating, such as Dr. Blevins mentioned about the Black dolls and the white dolls. These things are dysregulating to be a person of color and have to experience them, right? So we need to, again, make sure we're doing the prevention, the promotion, the treatment, and ensuring that you know the policies and the procedures that will help support early care and education. I'm gonna speed up. I do see that we want to probably have some time for some questions. Thinking about school-based mental health services, historically, Medicaid has covered school-based services, but they were often limited to children with IEPs, right? There is no distinct Medicaid state plan benefit that calls out school health services or school-based services. Arizona is a really, really great model state for how they utilize school-based comprehensive services, and how Medicaid reimbursed that. That's something that if you have spare time, you can to look into. And then only about 55% of public schools offer mental health assessments for students. Again, thinking about that early prevention, detection, and treatment. Also, 90% of children with disabilities have a neurodevelopmental disorder or a disorder that was diagnosed with the DSM-5 or the DCO-5. If we are diagnosing children with a mental health manual, why do these children not have mental health supports in their IEPs? Why is not psychological and counseling supports in IDEA define these things so that you as providers and programs can support these children? It is a question that I am baffled for by myself. I am completely baffled as why we make these diagnoses using the mental health model, but do not provide our children the mental health supports they need and their family supports. It just really makes no sense. And I'm sorry, I'm passionate about that, but my son needed what he needed and couldn't get it. So lastly, I wanted to just sort of talk about that 54% of schools reported that their efforts to provide mental health services is limited due to inadequate funding, right? And we also know that 40% reported they have inadequate access to a licensed mental health professional. Yes, the shortage is real, but also Dr. Blevins mentioned that that shortage is real in the field of race and ethnicity and language as well, right? So yeah, they don't have it, but even if they did, we still have a situation where we all have to get up to speed, learn what our biases are, hold ourselves accountable. Something I didn't mention a second ago about infant and early childhood mental health consultation, reflective supervision, reflective consultation, reflective practice is part of that. In order for us all as practitioners to recognize everything that you've heard today, we all have to be reflective. We have to reflect every single second of the day. Black people, white people, Latinos, Native Americans, we all have to reflect. We all are socialized in this country. We've all been impacted by the colonizer, and we all have biases. They just are manifested in different ways, and the causes and the mechanisms that drive them are completely different. But we need reflective practice as well. It's not just a treatment, it's not just prevention and promotion, but the workforce has to be reflective. And the workforce has to be aware of their bias and check those biases and hold themselves in mind, as well as the children and the families that they work on behalf. So I will end there. I know there's 4 minutes left, but I'll end there for now. And just want you to think about this in your time and space in your place. And Gia, I could pass it back over to you. And I think we had our last goodbye slide. There we go.
Thank you.
Yeah, sorry.
No worries. We know that there is a lot of good information that was shared, and we can spend a whole nother hour. But I want to just take just a couple of questions with the time that we have left. So I see Elizabeth, your hand is up. So I'm going to ask that you will unmute and make your question really quick so we can get to a couple of others, please.
Gia, can you stop sharing so we can see people's faces if they choose to come up?
Yep, hold on. Is that better? Am I still sharing?
No, we just see you, but it's fine.
No, don't just see me. Okay, there we go. All right, did the hand up leave? I don't see it anymore. Okay, well, we'll go to the chat. I'm trying to see if we see anything. I just see a lot of, I love the presentation, agreement. One question from Michelle is, what is missing to truly put all of the best practices in ACEs studies that are being done? What is missing to truly put all of the best practices in ACEs study being done? And Michelle, if you wanted to speak to this, please come off of mute.
Sure. Dr. Kelly and your other fellow presenters, I can't thank you enough for this magnificent opportunity and your brilliance. My question, perhaps it didn't come out the way that I wanted to express it, but I'll try. I'm just curious to find out, there's so much research that is done time and time again, and everything that you guys have shared, you all have shared, is continuously reverberated, and I'm so distressed that the situation just seems to get worse and worse each time. So I was just curious to find out, what's missing? Why can't this be really ameliorated?
Yeah, I mean, I think that's a really, really great question. I think it goes back to Dr. Meek at the beginning. It's the groundwater, right? And we have to work together collectively to recognize that this groundwater is fueling these inequities, and it's gonna take a whole system. Like, we have to redo this entire system in order to, and yes, it is disheartening to me as a person of color to see this, but I think we have plenty of approaches out here, especially reflective supervision, practice, and consultation. We have to reflect on these things because our practices are not changing. Our beliefs are not changing. Our actions are not changing because we have to recognize these data, understand these history, sit with it and hold with it, and see what your experience and how you view these different inequities and what you can do to mitigate them. But a lot of the times, many people don't know that they are even biased towards individuals of color. They don't recognize their bias. They don't recognize their location when they're working with individuals of color. So it can help and continue to perpetuate these things. As Chantel mentioned, 88% of our story has been in slavery and segregation. So we've only had a short amount of time to work backwards and try to create to correct it. But I know we're for time. I'll give my colleagues some time to speak on that as well.
Anything you all want to add? We may take one more question after this, but Dr. Meek or Dr. Blevins?
I think part of the challenge that is a challenge by design is that over the course of American history, right, there was the period of enslavement, there was Jim Crow era laws, there were other, like, throughout this whole period. And then we passed, right, laws to make it, okay, now we can't discriminate based on race, but yet we've been doing it for centuries. And so now they kind of flipped that to make equity and trying to, things like reparations or priority on the basis of race to remedy those past harms and inequities. Now that's illegal, right? We see the Supreme Court striking down affirmative action. We see a new case every day in the courts where they are striking down the correction or the attempted policies that weren't. And so I think that is kind of built into the structure again by design, making it really hard to address that in policy. And so I think that is, just looking at the bigger picture, the Supreme Court, right, the policies that we're passing or not, what's considered legal and not, and constitutional or not, right? And thinking about those big levers that, again, it's hard to reverse by design.
Mm-hmm. Thank you. And I know we are at time, so we want to be mindful. So in the chat, Joanne just wanted to remind folks to let us know how you enjoyed this. We saw a lot of good feedback in the chat. We know that we didn't have enough time, so we apologize. We probably should come back for a part 2 at some point, since there's so much energy around this, but we wanted to just just really thank you all for your time today. And we wish we can get more questions, so we do apologize for the time being drawn short. Maybe we can stay for one more if the presenters are okay taking one more, or do we want to end here? It's really up to you all. Okay, I saw Corey come off. Corey, we can address your question and then we'll wrap up. If you have to leave, we totally understand. Thank you all.
Hi, everybody. Excuse my voice. It's been kind of coming back, but I guess the question I had was more related to how to navigate like the intercultural conversations, especially with here in Arizona, for example, the communities that we serve in Touchstone are indigenous, they are Black, they are brown. There's a lot of Latinos. There's a lot of different cultures and different perspectives. So I guess what I was curious about is how can I hold space and also maybe provide common ground for anyone who is still kind of in this process of recognizing the world we live in today.
I think that's a really great point that you bring up. And sometimes some things that we say in our community is that we can't compare traumas, like everyone has had their own experiences. And I think to answer what you said, or to provide an answer to what you said, it's recognizing that while we talked about like American slavery and segregation, there were things that were happening simultaneously with Native American families and children. There was things happening simultaneously with our Latino community and others. And I think that the way that this history in this country has been explained to us, particularly through our school experiences, those histories have been omitted. And oftentimes we just get one group depending on where you're located. But to your point, being new to Arizona, it is 4 to 16 different perspectives and experiences out here. And we all know that they all came from the same thing: to exclude them from the United States, right, way of life, right? Anti-Blackness has been real in this country. Racism is real. And I think all of our experiences have happened as a result of policies or law that were all happened simultaneously in that timeline that Chantel shared. And we all have to sort of learn those histories and be aware of those histories as the time goes on. Is something that I would mention to that. And again, Dr. Meeker, Dr. Blevins.
I mean, I could just add that the hierarchy of white supremacy, right? Like like part of the purpose is to keep everybody separate and with a different proximity to whiteness and power to hold on, just like we saw, right, early on in American history, which we didn't touch on so much, but part of that explicit intersection of economics and race was creating a disconnection, right, a separation between Black folks and poor white folks at the time, right? So that we could, again, create this hierarchy, proximity to whiteness and resources. And I think from then and like all through history, right, part of the strategy of white supremacy, right, is to separate us all and put us all against each other so that there's still like, there's fighting over here and nobody's touching, right? The top of the hierarchy in itself is the problem. And so I think there are lots of tensions between and across communities, but also a lot of, and our experiences are different and our challenges are different and our histories are different, but there's also a lot of shared there. And I think that's part of, how we need to come together and talk about it.
And Corey, I wanted to, and before we wrap up, I just wanted to also acknowledge that Dr. Blevins put a resource in the chat to also that she thought would be good to answer your question. Did you have something to say to that, Dr. Blevins, before we wrap up?
Yeah, I've been trying to answer questions in the chat. I have been using this book and the work of Ruth King called Mindful of Race. She offers meditations and an analogy of addressing racism as a heart issue. And so she doesn't shy away from talking about policy change, but she also understands that we're human beings having this conversation. And so there are ways that we can approach this conversation from a reflective standpoint that helps us come together, but also be able to tolerate some of the discomfort that comes with having this conversation.
Thank you for that. So we're going to wrap up here. Thank you so much to our wonderful presenters for such great information. Thank you all for being an amazing audience today, for your questions, your energy. We really, really appreciate it. Don't forget to let us know what you gained from it, from our survey. And we wish you all a good rest of your week and an amazing weekend. And we'll see you all soon. Thank you.
Thank you.